I had somebody ask in a comment on one of my videos what I think about medical tourism, because they said they don't think they'll be able to afford skin removal surgery in the United States. So here are my thoughts. One, I don't know how to evaluate the quality of foreign physicians and medical centers. Here in the United States, you want a board certified plastic surgeon. You go to the American Board of Plastic Surgery, you look them up, there you go. You don't want a cosmetic surgeon, training is very different. And then for them to be doing the operation, you want them in an accredited surgery center or hospital. So for those AAA, HC, or quadruple A certifications for outpatient surgery centers, surgeons have to have those same privileges at a nearby hospital. They have to have emergency admitting privileges. So you ask them, is this a procedure that you are credentialed to do at a hospital? I do all mine outpatient at a surgery center, but if you're someone who's not trained in that specialty, like for example, if you're an OB-GYN who started doing tummy tucks, random example, you're not gonna be able to get credentialing at a hospital to do that procedure because you didn't learn it in residency. So are you credentialed to do this procedure at a hospital, and what is your board certification in? I don't know the equivalent for foreign countries, so that's one issue. The second issue is, what do you do when you have a complication? And it can be very minor, but skin removal surgery especially, I am often seeing those patients weekly for small wound healing issues, for seromas, for drainage, for areas that need a little bit of silver nitrate and granulation tissue. And even just with a regular tummy tuck, you can have things like that. So if you are in Mexico for a week and then you fly home, you don't have anyone to follow up on any of that stuff. I can guarantee, I have been asked to see patients who had surgery overseas, and like, I don't want to manage somebody else's complications. And even if you find someone who will manage it, you are paying out of pocket every visit, possibly hundreds of dollars. So when that all adds up, it may not be less expensive. The third thing to think about is whether you are safe to travel so soon after surgery. Increased risk of blood clots in the legs traveling to the lungs after major surgery, and just risk of infection and things like that. Are you going to be able to move easily? How long do they want you to stay there? With all of those things included, when you look at the total risk, if you were to have complications, often it's not really worth it. Now, I do have patients travel to see me in the US, but if they have complications, they have my cell phone, so we can figure something out, which I think if you're getting treated overseas is probably less likely. And B, often I know somebody who's in their area. I've seen patients for other surgeons who were local to me but traveled to them for surgery. Like, we can trade off. We have a network. That's not necessarily going to happen overseas.